What if your entire pathology workflow, cytology, anatomic pathology, all the way up to the final report, could live within one platform? In this episode, I'm joined by Dr. Tiffany Chen and Ben Cahoon from Techcyte to talk about Fusion, their integrated digital pathology platform combining diagnostics, AI, and reporting into a seamless experience. We'll cover AI in cytology, standards-based interoperability, and what it really takes to bring digital pathology into your daily pathology practice. Let's dive into it.
Learn about the newest digital pathology trends in science and industry, meet the most interesting people in the niche, and gain insights relevant to your own projects. Here is where pathology meets computer science. You are listening to the Digital Pathology Podcast with your host, Dr. Alexandra Zhurov.
Welcome, my digital pathology trailblazers. I have listened to Tiffany's webinar. Dr. Chen gave a webinar on a new software from Techcyte, and Ben was one of my first guests on the podcast when you guys were starting. I don't know if you were starting or if you're already ongoing, but I want to start with you. Let's, Tiffany, tell the listeners, tell the digital pathology trailblazers about you, about your background, how you joined Techcyte, and what's your role in the company.
Hi everyone, my name is Tiffany Chen. I'm the Chief Medical Officer here at Techcyte. I'm a board certified anatomic pathologist. I did my medical school training at the Mayo Clinic and then did my pathology residency training at the Brigham and Women's Hospital. And then after that, I did a formal NIH postdoc in computational pathology. I fell in love with computational and digital pathology and decided to go into research. And then I moved into biopharma, and shortly after that, maybe 2 years after that, I moved to Techcyte. So I joined Techcyte almost a year. It's been almost a year now. So
yeah, we've seen each other on that's the third conference.
The third time we've seen each other. Yeah.
Yes.
Which is great. It's always great to see you.
Exactly.
So, yes.
Ben, how about you?
I went to school, I'm a computer scientist, but I had the opportunity to work at Intel early on in my career, and so they basically paid for me to go back and get my MBA. And then after that,
So you did, why not, right?
Right. So after that, I have basically been running and building companies, and mostly software. I love software, and this Techcyte has been amazing because we've been able to impact not only the lives of humans and the people who are getting the test, but also of pets and the environment. So we have sort of three divisions of the company.
Yeah, let's give a quick intro to what Techcyte does.
Okay, so Techcyte has a digital platform, a SaaS-based platform that combines workflow plus AI to diagnostic testing and pathology. So we started off with a mold test, so I can quantify about 160 different types of mold, particulate, and
I remember how
that?
surprised I was with that when we first talked about it. And it's a big deal in the industry.
Yeah, so it's growing really well. It's a great business. It's doubling every year, so we're really happy with that business. It's sold to home inspectors and industrial hygienists. And then we partnered with Zoetis to build out their digital diagnostics platform on the Grundium scanner. So that has been growing very, very nicely. We've released everything from blood, urine, parasitology, digital cytology, and that's now all over the world. And then we have been focused for many years on clinical pathology, which is, we've defined loosely as liquids and cells. So like we do pap smears, which is officially part of anatomic pathology. But we've really left tissue for others until today. We announced our Fusion AP product, which is a digital pathology platform for both surgical pathology and use cases such as use cases such as frozen section and education and pharma, etc.
Amazing. Following on that, on the mission, what is Fusion and how does it relate, combine? What does it do with the work that you did previously? Because there was a lot of things already done at Techcyte, and now my impression is Fusion is fusing it all, is binding it, but I would love to hear from both of you.
Yeah, thank you. So Fusion is built upon the same base that we built our clinical pathology platform on. So it includes we did add a lot, so it includes both a work list and a viewer and AI all included, but specifically designed for anatomic pathology versus clinical pathology. And if you look at anatomic pathology workflows, they are much more complicated, and so we've been very, very busy coding that up for about a year and a quarter.
What does it mean for the pathologists?
Yeah.
And basically for healthcare professionals, everybody involved in the pathology workflow, and for the patients.
Yeah, like Ben had mentioned, pathology workflows are quite complex and they can be quite fragmented as well. So you have lab techs, you have histotechs, scan techs now with digital pathology. We have our pathologists, admins, trainees. So you can imagine everyone needs to work together to really further patient care. So for Fusion, we want to make this experience just way more pleasant and delightful for these users. So not just the pathologists, but everyone who's involved in this part of patient care. And for pathologists, their day-to-day, just speaking as a pathologist, when you're going through your patient cases, you're going through different systems as well. So you may be living in the LIS and then in the EHR and looking at prior radiology, trying to connect all these different pieces together to help your patient get the best diagnosis. And for Fusion, we just want to be able to let pathologists focus in one place and bring all the data points to them, to let them really evaluate the case and get the best possible diagnosis they can, and to generate these diagnoses with confidence as well.
When you think about Fusion, you were right. We're bringing together, we'll be the first digital pathology platform to bring together both clinical pathology, anatomic pathology, but also all of the systems and the people together. One of the key points that we learned in clinical pathology is if you need to be able to infuse AI in that workflow. If you don't infuse AI into the workflow, you won't see the efficiency and the accuracy gains that we've seen in other areas.
So that's something I saw at Path Visions last October. That was the pain point that pathologists had, that they have to open this window and that window, and you know, this pain point is being addressed from several angles, including large language models, but the main thing that they were suffering from, like, just give it to me in one place so that I can do my job. And it sounds like that was your guiding star as well for them.
Yes.
We make it easy for the pathologists. We have clinical, anatomic, but what does that mean other than just not opening multiple windows? What are the efficiency gains for somebody who's going to start using this, both on the organizational level and on the user level? And you already mentioned, okay, we have the option to infuse AI. Anything else? Like, I want to hear the tangible things that people will gain when they start working that way. I guess both for organizations, pathologists, patients.
If you look at pathology labs, what's the thing that they hate the worst? It's dealing with IT.
IT, yeah.
Right? And being able to get the time and the effort to really integrate their systems with IT. So we make that very, very easy by using an open standard-based platform. So standards like FHIR, DICOM, HL7 are all infused in the platform so that it makes it easy on IT to integrate these systems in. From a purchasing perspective, right, you can go to one vendor to do the security audit and all the regulatory issues that you've got to face when you're implementing a product like this. So we're trying to make it easier for both purchasing, IT, the C-suite, to make it an easier process there.
For the user, at least for the pathologist, I think the first thing we have to do is really digitize their workflow before we can start enhancing it using AI. And we've seen a lot of developments within AI in the last few years, so really advanced AI for diagnostics, but there hasn't been a clear path on how we can actually deploy that within the clinical workflow to get those efficiency gains that have been promised. So for us, we have an AI marketplace, and we plan to support as many AI vendors as possible, and including our own Techcyte AI or any institutionally developed AI as well. And we believe that by hosting it directly within our system, we can pull it into the clinical workflow. Pathologists can actually use it in their day-to-day to help them prioritize their cases, triage, assist them with diagnostics, and that will really just finally deliver on what AI and digitization can do to the field of pathology.
I think that's so important because there are these like, and we're going back to the concept of fusion, the concept of merging this, because the possibilities are out there, but the implementation, the applications, not yet, because it's just so much hassle to do it.
Right.
And you mentioned standard-based platform. That is so important. Like, are IT your friends now?
We hope so. We hope so.
Because I just had a conversation yesterday at breakfast that there should be somebody consulting those institutions how to integrate it in AI, and I said, well, I don't know if you really can do it because everybody has a different architecture, everybody has different databases, different like homegrown systems for something that has to be integrated. So I think this is actually the role of the vendors to guide the institutions, the pathologists, whoever is going to be using it. So you guys are guiding them closely and working with IT, I assume.
Yeah, I'll give you an example of that. Here at the show, we've integrated both AOSIN and FHIR into the platform, and the annotations are coming back through the DICOM annotation standard. So that's a pretty cool development.
You know why I'm so excited? Because annotations are always like, okay, DICOM image format and all that stuff, more or less interchangeable across platforms. You can ingest stuff from different scanners. But I feel super strongly about annotations because there are so many pathologist working hours going into that. And then it just sinks into the projects and you can never reuse it. So I think you're the first person who actually said, oh, we can exchange annotations. Thank you. Thank you for that. Let's talk about the collaboration. You said you integrated with AOSIN and FHIR. What are you collaborating on? What did you integrate, and how is it going to help?
So let's start with AOSIN. AOSIN is pretty cool that they now have CE-IVDR cleared algorithms. And basically what we did, there's two key ones initially. First one's slide QC. So being able to, if you don't have QC integrated into your scanner, then like many scanners don't have that today. They've created a slide QC algorithm, and we've integrated into our manual slide QC tool that we built. So if you don't have AI, if you're just doing this manually, we've got a tool to help ease that, and then we've integrated into their AI, so it can automatically find blurry regions and folds and other issues with the slides. And then we've also integrated their other algorithms, like I believe there's a kidney.
Their glomeruli, their kidney algorithm, their mitosis counting algorithm as well.
Correct. And then with FHIR, we've been working closely with Mayo Clinic, and they've used FHIR extensively within their organization. So they wanted to be able to bring those algorithms that they built onto the platform, so we can bring in both FHIR externally created algorithms as well as if an organization used FHIR to create algorithms.
I think it's kind of. I would say it's a superpower of Fusion because you guys don't have the capabilities to self-develop algorithms, right?
No, we do.
You do as
Oh,
well?
absolutely,
So
yeah.
you can. Well, let's talk about that as well.
So we've been developing algorithms, back since 2017 just after we had started.
Is it your team or is it the users that can?
No, it's our team.
Exactly.
Yeah,
that's
so
what
our
I
team.
meant. That's what
Okay,
I
yeah. So
meant.
FHIR allows other users to create
yes,
algorithms.
Yes.
We create algorithms ourselves, and then those algorithms can be in the platform. For example, Tiffany and the Mayo Clinic team have been working on some dermatology algorithms to rotate the epidermis to the top and count mitoses and look for inflammation.
Yeah, so that's exactly what they wanted to emphasize, that there are these platforms, and FHIR is your partner, there are others, where the researchers, and Mayo Clinic obviously has a strong research group, and I interviewed several of their researchers, Dr. Rish Pai, on a podcast as well, and he was working with FHIR, and that's a super, big effort that they have. And then there are the platforms like the one of yours where you where you collaborate more with an institution to build something that is deployable at an institution. So how do you merge these two approaches? And it looks like you just merged it. So how can they just keep so they develop their stuff and then they can deploy in Fusion.
Plug it in.
Basically, yeah, you create an algorithm in FHIR, you can basically deploy that right within Fusion, or use one of our algorithms or other partners like AOSIN.
And you don't have to double annotate, nothing you just did the work once and then it goes into another system. This is a superpower. I think it's the first time, and you know, the superpower only lasts for so long because everybody sees it and they want to do it as well because it's a good development. But you guys are the first company where I see this on-demand image analysis algorithms that many of them never make it into a tool that could be deployable into an organization. And you have a group that works on that, and then whatever makes the cut can be deployed. So that's super cool. Tiffany, this one is for you because it's about AI for pathologists. Other than workflow, and I specifically would like to know about the cytology algorithms that you guys have. How does it change the pathologist's life?
Yeah, so
and you already mentioned pieces of it, but let's talk a little bit in depth. How is it going to be different for the pathologists to do their job now with the AI? And feel free to tell me specifically what you guys have and how it's going to work.
Okay, great. Yes. So we've been really passionate about actually making AI deployable within clinical workflows, and I think a great example of that is our SureView product, which is our Techcyte cytology product that we've, I guess, launched a year ago?
Almost a year ago.
Almost
Is
a
that
year
the one
ago.
Corplus is using?
Corpus is using it,
Corpus.
and then BD distributes it
Yes.
worldwide.
Yes.
Yeah. So I've heard about it. That's why I asked the question.
So yeah, so SureView is it's an AI tool that helps cytotechnologists identify and triage their cases and flag regions of interest. So this helps build confidence and really empower them to be able to go through their cases with the software to be able to identify like these regions. And you know, with cytology, we've been dealing with a lot of high volumes, and with a lot of pathology, you see there's high intra observer variability, and it really depends on like levels of experience, especially for cytology where the morphological changes can be quite subtle. So with this type of software, we want to empower them and make them feel more confident as they go through their cases that they aren't missing cells, and this has really driven down false negative rates and has just improved their day-to-day life. They feel like they can do not only more cases, but do them well. And for pathologists, cytopathologists, it's if you have great, happy cytotechnologists who are able to help you screen, that helps your life significantly as well. So we've seen just really great feedback across the board from cytology labs who've been using our product.
So is this now incorporated into the current workflow? So this is, radiology has more of those screening tests. This cytology test for cervical cytology is one of the few that we have that are more screening than diagnostic. And to me it was always, okay, AI is a perfect help for a screening test, because the current workflow, and I'm going to ask you to elaborate on this. The current workflow is the cytotechnologist screens and then shows stuff to the pathologist, right? Can you compare and contrast the classical workflow and the enhanced workflow?
Yeah, so cytology is really unique within pathology. Like you mentioned, it's one of the few fields that have this screening mechanism built in. And cytology is actually, I would say, one of the first subspecialties within pathology that has moved towards AI. So this screening process has been around for many, many years within cytology, and now we're incorporating more things like AI assistance into it. So in the past, we have cytotechnologists, they'll screen all the cases and then they'll flag specific diagnoses. So if it's a positive diagnosis for any type of cervical lesion, that of course goes to the pathologist, but there are also borderline cases or reactive cases that can be really tricky. So those are flagged as well, and a lot of these are according to, obviously guidelines, but also by institution, they have different limits to when they will forward the cases to the pathologist. And in addition, there are things like organisms that also need a pathologist to review. So as a cytotechnologist, you not only have many cases, but you have all these rules of like when to send these cases to pathologists and all these different diagnoses that you have to make. And you can imagine that that can be quite a lot for a cytotech. And the cyto volumes.
Do you guys have that integrated?
Yes.
Oh, wow.
So our product is for like the cytotechnologists to really improve their day-to-day workflow and help them triage those cases. We have reporting built in, and if the reporting shows a specific diagnosis that gets like elevated or leveled up to the pathologist, the case will directly go to the pathologist queue. So it saves them that extra time of being able to remember like what cases they need to move forward, and it's all in like one place for them.
This is amazing. That's like workflow efficiency on steroids, I would say. Especially for this use case, because like you say, it's high throughput, a lot of negatives, but then you're never 100% certain, oh, it's really negative. So if you have an AI assistant, that changes the game for sure.
And it requires, I would say, a lot of experience and skill to train your eye to be able to identify sometimes single cells within a slide with thousands of cells. And there's cytotechnologists like come from all backgrounds and all levels of experience, and we want to be able to elevate and empower all of them regardless of their experience, so they feel confident as they review.
I think when this is often like this AI assistance is often, especially by the less tech-savvy group of pathologists or those who are maybe late adopters, this is flagged as, oh, are we even gonna be thinking on our own? Are we going to be able to recognize it? Are we going to blindly trust AI? I think it's the other way around, because you get so many examples shown so fast, and this is how you gain pathology expertise, right? You look at it, it's pattern recognition in your brain and in your eyes. So the more you see of it, the better, and then you can you have it flagged, you have it like labeled on the image. That's another story, like to find these things within the image, so the AI helps to localize. And then you have the pathologist giving you feedback, okay, was it really something that should be flagged? And it's not just for the algorithm, it's also for the person who decided to click whichever button and send it to the pathologist. So I think that learning and training, like I say, they come from many different backgrounds, is accelerated by just using this tool. So that's another advantage that I think in general AI, but you guys have it incorporated in one platform. Fusion also has the bacteriology, right? The gram stainings. How do you work with microbiologists, and how is that integrated? Because that's even outside the pathology department in the hospital, right? Or
well,
how do you do
in
that?
the U.S., so microbiology will fit under clinical pathology departments, and I think globally microbiology, I think, sits in its own department. But at least from what we've seen so far in the U.S., it's a core part of the clinical pathology workflow, and similar to how it is for cytology, within microbiology, you have lab techs who are triaging and reviewing and screening cases that can be quite tedious. You can imagine trying to identify little bacteria on your slide, and it's not only tedious, but it's like very strenuous on your eyes as well. So we built our bacteriology product that allows the techs to be able to screen their cases faster with more confidence as well, when it comes to being able to identify things from gram-positive to gram-negative, cocci or rods, as well as other things like white blood cells and epithelial cells too. So, Ben, you want to add?
Yeah, so this product was developed with Mayo Clinic. It was a very tight collaboration. Their experts and their data was all used to create workflow in AI that would basically seamlessly make that whole process more efficient and more accurate. And that was also, that product was developed to work with manual smears, Copan smears, as well as the BD Keystra. So whatever TLA solution or manual method you're using, you can use that to scan the slides, get it up to the cloud, analyze them, and then you're presented with the results, so you can compare the culture results to the gram stain.
You mentioned Mayo Clinic a few times. I think being able to develop a product in such environments is a game changer, because you basically have it pressure tested from all sides. So that's super cool that you had the opportunity to work with them. And how many pathologists worked with you on that project? All of them.
A lot. A lot of pathologists, but we also incorporated in a lot of the techs too. So, so we're again focused on building those products that can help multiple different lab users and stakeholders, not just the pathologists. And we've seen with microbiology, like the techs, they're carrying a lot of these, the volume and then the screening and all of that. So we incorporated a lot of their input and feedback into the development of this product.
Amazing and very comprehensive and I would say basically compatible with the mission of a healthcare institution, right? You can develop a nice tool for one special. Oh, and that's something I heard yesterday at lunch. I was talking about GU, a genitourinary specialist, and she says, "Oh, I don't do digital pathology. But my colleagues, pulmonary cases, they all get scanned. And these cases, they all get scanned." I'm like, so in the same institution, one pathologist has zero experience with digital pathology, and the other one is used to working fully digital. So, and that's not an isolated case.
No, that actually is seen across many institutions. It's just, it takes a lot to move everyone onto digital, so they tend to do it quite piecemeal with certain subspecialties. Their workflow may work better digitally, or if there's just less resistance there to do that first.
Point. Less resistance.
We actually started down the whole microbiology path with parasitology. And we do trichrome fecal.
Solution for scanning the fecal sample.
Yeah, it's very difficult. So we've been in production at ARUP since 2019. So hundreds of thousands of fecals have gone through there. But then we just released this year a solution for wet mount fecal. So in the US, you do both trichrome and wet mount to get the best solution. And now we've got a full solution for parasitology as well.
Okay, so we have microbiology, AP, cytology, parasitology. It's like everything you can look at that fits on a slide.
Yeah, anything on a slide.
On a cellular level,
Yeah,
let's call it cellular level, fits into fusion. That's super cool as well. We already talked a little bit about the partnership with Mayo Clinic, but other than this helping you develop a robust product for an institution, how did it influence your company and in general, like the way you work, or did it change anything, or was it just like a great partnership and we have a good product that people can use? What would you say about that?
Yeah, so before our relationship with Mayo Clinic, we were really forced to go and get data from all over the world. So a lab in Mexico, a lab in Luxembourg. We worked very closely with ARUP as well. And the relationship with Mayo basically solidified our ability to get amazing data, work with amazing experts to create workflow and AI, that then we can then figure out the best way to get that out to the world. So the best example of that is probably initially cervical cytology. We developed it with Mayo, and now BD is distributing that solution worldwide, and that's sort of the model. Develop things with Mayo and get it out to the world.
I love it because it does not just stay within this like limited amount of institutions that are digitally enabled. You kind of leverage commercial expertise and the commercial power of your distributors. You did a similar thing with Zoetis. So I love that this goes to the world and increases the adoption and advancement of digital pathology. Because, you know, developing a nice product is one thing, but then getting it out there for people to use, and not only on the logistics, organizational level, but also, Tiffany, like you mentioned, change management level, comfort level of users, not only pathologists, but the whole care team. Tiffany,
yes,
for both of you, but I'm going to start with you because I heard you talking about this at the webinar, and that was audience questions. How does Fusion integrate with the LISs, the electronic health records, and all the systems? Which systems does it integrate with? What would be the path for somebody if they wanted to use it to be compliant and to be integrated?
Yes. So for Fusion, we built it to be flexible depending on your lab's needs. So some labs, just depending on what LIS they have or what EHR their hospital or their clinic uses, it really depends on those factors as well. But for us, like Ben mentioned, we are standards-based. We want to integrate with whoever is willing to integrate with us, and for our.
Is there a list of the standards that you guys are compatible with or based on?
Yeah. FHIR, HL7, DICOM Web, and then you can go a level down from there. But those are the key ones from a digital pathology perspective.
So basically, if somebody wanted to know, they reach out to you and you have the list and all the specs and everything that it integrates with, and if that's what they want to integrate, you're good to go and you can start working together.
And that will be for us to work with their vendors, and if their vendors also are standards-based and can communicate with us, we are able to integrate directly with them. And how we've designed Fusion is if someone wants a LIS-driven workflow, they can still do that with Fusion. If they want a PACS-driven workflow, they can do that with Fusion. So it's built to be flexible, and we realize that labs function so differently, and the lab infrastructure, the IT infrastructure varies so differently, and systems that they use are also so different. So for us, we believe if we can stick with the standards and be willing and open to develop bidirectional integrations, then we can really tap into this optimal experience with Fusion, but we will support many different workflows depending on how we can integrate there.
So what's next? This is obviously a milestone that I've been hearing about since last US Cup, right? When we met briefly. So what's next?
So now that we've got the basics of a platform in place where you can connect to the EHR, the LIS, the VNA, for grossing images, etc. Now that we've got that basis, we will be adding very specific workflow and AI for each of the subspecialties. So if you look at derm, breast, prostate, etc., GI, infectious disease, right? There are lots of opportunities. Each one of those subspecialties has unique problems and challenges that they have to do, whether it's counting and estimation or like with derm, rotating the epidermis on top. All those little things make a difference. And then so if you think of the workflow and the AI, that will drive efficiencies into reporting. So I view Fusion, we're just at the very beginning of what reporting will look like, and ordering stains to then eventually get to that report, but the tight integration between the viewer and the report.
Oh, the viewer and the report, yes.
Will speed, for example, synoptic reports. We actually have integrated all of CAP's reporting templates, the synoptic reports, into the solution today. So you don't have to go to another vendor to get that. You can get it right within Fusion and then export that out to the LIS.
And it's really cool with how we've set it up with reporting right now, where you can have smart reporting and you have fields that require measurements. You can drop in an existing annotation, or you can make an annotation and measurement right on the spot, and this will fit directly within the report. And we believe this will just make it easier when you're doing reporting. You don't have to scribble down a number and then remember it and copy it down somewhere else, or any of that manual entry, and that will just make the reporting experience just much more pleasant. And synoptic reporting can be a long and tedious process. You have to bring in measurements from the gross. You have to remember margins and distances that are spanning different slides, and we want to make sure that for the pathologist who's doing the synoptic reporting, they can do it very efficiently. So we're really excited about being able to incorporate that in.
Are you looking into large language model enhancements and agentic AI? And you kind of have an agentic workflow already when you were mentioning how it goes, how it gets flagged for the cytology, and then what's the decision to elevate it to the pathologist. So that's when I thought, okay, that's an agentic workflow. Any thoughts on that?
Yeah, there will be multiple areas to integrate agentic AI. Prioritization at the work list level, taking that EHR data that we now have access to and summarizing that, and then as well as the whole opportunity to order stains and then integrate and generate reports. So there are multiple places where we see agentic AI getting infused into Fusion.
Thank you so much. I will be visiting. We're going to do a demo, so if you're listening to this on the audio, go to YouTube and check the video about the Fusion demo. Thank you so much for joining me, and I'm super excited, and I've been waiting to do this podcast for a year, guys.
Thank you.
Thank you so much.
If you're at USCAP, ASCAP, come to booth number
920.
920. We're at booth 920, so visit us. And if not ASCAP, then the next conference. What's your next conference, guys?
We'll actually be in Europe in a couple weeks at ESCMID for the big microbiology show, and then the big one this summer is ASM, and then there's lots of other shows.
So look for Techcyte and check out Fusion. Thank you so much.